that the human body requires more than 42 different nutrients. And all these are essential, and not 4 or 6 nutrients. The best manufacturers of these nutrients are plants and not Roche. Plants extract nutrients from the soil to make the grains, the vegetables, the roots, the tubers, which we consume as food. So agriculture is very important here. And I would like to follow on what Madam Rhoda has been saying about the initiatives for agriculture. We have so many of those. Now we have CADAP. But we need to realize that for many farmers, family labor still represents the main or only asset for agricultural productivity. So quality of the agricultural labor force is an important component for agricultural production. And this has often been neglected in development planning process and nutrition interventions. For example, there's never been very few of these initiatives have focused on or included aspects related to improving human labor productivity, of which the most important components include health and nutritional status of producers. So the quality of agricultural labor force is often suboptimal, especially at the time when they are required to provide much of the power needed for agricultural production. And this is the time when malaria prevalence is high, food insecurity is rampant, and malnutrition is high. So we cannot expect these people to really produce and produce enough for themselves and for the market. So there's a need to include actions that will address the quality of agricultural labor force. Again, we have initiatives that have been implemented, like biofortification through crop nutrient improvement, for example, high-quality maize, high-quality potato, and all those kind of things. But these approaches have often been top-down, externally supported, not demanded. In addition, the breeding that is going on, increasing the nutrient content, one of the nutrients, we don't know how that tilt the balance of nutrients in the crop and how that affects the nutrient utilization by the body. This has not been established. I hope the initiatives that are doing this would come up with an answer. But do we really want our people to continue eating maize or orange-fleshed sweet potatoes? And this defeats the whole purpose of biodiversity, dietary diversity, and agriculture biodiversity in solving nutrition problems in Africa. So there's always an assumption that if the food is produced, then it will be consumed. In most cases, that is not the case. People produce, but do not eat. And in Africa, eating is not enjoyed, which is something that has to change. So our people actually need information on how best they can combine the foods that they produce to maximize nutrient availability and utilization for their own nutritional status. Another issue that has been touched on by my colleagues here is about sectoral approach. Yes, we have blocks, we have silos, and these have been very difficult to break. I'm sure people who have been battling with getting other sectors into action can testify to this. But we need to remember that at the community level, there are no sectors. There are livelihoods and life. And in fact, agriculture, nutrition, and health is a continuum. It's their way of life. They produce, they eat, and the outcomes are there. So I think we need to change, that we need to organize ourselves, reorganize these sectors so that they can have a perspective whereby looking at the needs of the communities instead of their own existence and survival. Another aspect was about agricultural planning, and I would like to echo what Rosanna just mentioned, agricultural planning with a nutrition and health lens. The goal of agricultural production should be to produce food for health and nutrition. Planning for food production should be used on the should actually be based on the nutrient requirement of the population, nutrient-based planning, so that we know, for example, how much of the vitamins are required for the entire population, which crops are best suited to provide those vitamins, and how can they be produced, how much should be produced, so that at the end we know exactly that we have requirement for so much of the nutrients, and these are the crops that can be able to provide that. And in most cases, our planning has been based on cereals or energy, less on vegetables, less on fruits. Even the statistics, agriculture production statistics for vegetables and fruits are non-existent in our agriculture production statistics. So we need to incorporate that to factor in micronutrient aspects in the agricultural planning. And indicators for agricultural performance should include assessment of health and nutrition attainment. And in this regard, I think nutrition economics will be very relevant here. The measures of yield per hectare should be translated in terms of nutrition and health. How much nutrition is or will be derived from a 1 hectare yield of a given crop? Or how much health is or will be attained by a 1 hectare yield of a given crop? I think I would like to echo what the AVDRC are doing. They showed us statistics about a 6x6 plot and how much iron or vitamin A is actually produced from that plot. So I think that should be the way to go, planning with agriculture and planning agriculture with nutrition and health lens. Another aspect that I need to touch on here is about training. Training has been in compartments, no linkages at all. I think we need to come up with flexible programs that can allow people to cross, inter, multi, whatever way we could do that, so that they can be able to be at least versatile and comprehensive in their training. And for those who are already in the field, working out there, I think we can assist them to have a seminar or training on agri-nutri health. So that's another cause which should come up, agri-nutri health, so that we have agriculture, nutrition, and health there. Research, I think this has been mentioned. In Africa, nutrition, agriculture, and health problems are huge and require multiple ways of solving them. And this calls for holistic and integrated approach to research. Interdisciplinary, transdisciplinary, cross-disciplinary, those agenda and protocols I think are needed. And these are necessary in order to actually, in addition to the science that we get from research, we also need to capture the social and anthropological issues of agriculture, health, and nutrition in communities and households. So the approach should be demand-driven, research should be demand-driven, participatory, and action-oriented from the community level. In addition, we need information. Farmers would need information perhaps on when they go in production, what are the kind of foods that they need to produce so that they can meet, first of all, their own nutritional needs, and perhaps other crops for market. So that's also an area that is needed. Another area which I think is important is about gender, and this has mentioned over and over again. But we need to change our approach on how we approach this gender issue, because the focus has been on women, but women don't live alone. Women live with husbands, with children, with all those people around them. So the focus on women, I think, has delayed us on achieving some of these Millennium Development Goals, because these are vulnerable, and if you want to go to a battle, you don't pick the vulnerables, you pick the strongest and the vulnerable together so that you can have an impact. And I'm saying this because we have seen now and again that if you target a household or household members, you have more impact than targeting only women. Because women, as we know in Africa, they are not decision makers. And one man one day remarked that, all these years we have been talking about child nutrition, maternal nutrition, nutrition education, and in fact you have been targeting the wrong people. You should have been talking to us, because we are the decision makers. And we have noted in the projects that we've been doing that, in fact, men respond faster to our messages than women. So strengthening agriculture, I think we need to really, these three sectors are very important. Agriculture, nutrition, and health are important. But these also need the public, private, and commercial people there who would have to be linked and coordinated to enable this agenda to really move forward. However, the most crucial partners are the communities. This is where action ought to take place. Therefore, involvement of communities or villages to ensure greater participation and outcome is critical. Nevertheless, it should be noted that nutrition, health, and agriculture challenges are not the same in all communities. Differences do exist both within a community and from one population group to another. Therefore, we need to contextualize nutrition, agriculture, and health issues, as well as identification, prioritization of the issues to meet the specific needs of each location, and this would be necessary to eventually mainstream nutrition in community or village agriculture and health development plans. Thank you very much.
Thank you very much, Joyce. I would like to invite Ismail, please.
Thank you, Madam Chair. I would like to share with our participants the key achievements in the West Africa region through the West African Health Organization, ECOWAS, in the integration between agriculture, health, and nutrition for improving food and nutrition security. And in that framework, the promotion of the biodiversity is a central piece. Before that, I would like to make a remark after one concern from Rosanna regarding the collaboration between WAHO and the ECOWAS Commission for Agriculture, Environment, and Water Resources. We are working closely together, and last May 16 to 18, we have developed a joint action plan, which is over there, in collaboration with FAO and Biodiversity International, among other partners. The other issue is that the ECOWAS Commission for Agriculture is part of the regional economic community. ECOWAS is the regional economic community for the implementation of CAADP. Even if it's not perfect, we need to take this opportunity to strengthen it. I will skip the nutrition situation in West Africa, which is characterized by the double burden of malnutrition, because stunting is very high, and cardiovascular diseases, chronic disease in general, obesity, diabetes, cardiovascular disease are increasing as well. The situation of agriculture in West Africa is very difficult in this situation because we need to keep in mind the policy reforms in the 1990s by the Bretton Woods institutions, and up to now, resources for agriculture are very slight. Countries are affected by climate change effects and also by the global increase of food prices and a structural food insecurity due to a lack of access to foods. And this was highlighted during the last meeting of the Network for the Prevention of Food Crisis in West Africa in December 2010 in Accra. From different meetings in West Africa, I can say since 2006 to 2010, we recognize that no West African country provides 30% of the national budget to agriculture sector. Agriculture, health, and nutrition are still working separately. Agriculture sector represents at least 70% of our workforce and can contribute up to 60% of our GDP. And the livestock sector alone can contribute up to 40% to our GDP. This means that we need to invest in this sector, otherwise we will never see a sustainable development in the sub-region. However, it is still a challenge to build a strong collaborative pathway between agriculture and health and nutrition sectors, as we have discussed it at the ECOWAS Nutrition Forum in 2008. The report is over there. To ensure food and nutrition security, we need to take into consideration several issues. One is food availability, that is the supply side, food accessibility, that is the demand side, and also food stability for sustained access to foods. And the last point is food diversification. In terms of initiatives, WAHO and its partners are addressing the huge gap around food consumption, focusing on good quality, dietary quality and dietary diversity, for reducing the rates of undernutrition, overweight and obesity, and also improving food and nutrition security in the sub-region. Achieving greater dietary diversity may not be expensive for households, as in the promotion of local and traditional foods, like green leafy vegetables, other nutrient-dense foods, unfortunately considered as low-status foods. Moreover, since poverty is such a limiting factor in household food consumption, our partnerships involve smallholder farmers networks, agriculture and health and nutrition policymakers. Smallholder farmers can produce and supply markets, and at the same time promoting, preserving biodiversity of traditional food and also local knowledge. We have implemented several initiatives in coordination and harmonization, and also partnership and advocacy, as said by the others. I can say that from 2006 to 2010, in collaboration with a variety of international and regional partners, as well as agriculture and nutrition officers in country, WAHO and partners support the integration of nutrition indicators in the early warning system data collection in West Africa, extended to some countries in Central Africa. But we are facing to a major technical constraints because we do not always know the composition of the local and traditional food we are producing. That's the reason why we are currently compiling existing information into a West African food composition database. Other important steps include advocacy, raising public awareness, on food and nutrition, and building capacity of smallholders through the action plan of Abuja we have developed with the ECOWAS Commission of Agriculture. Last year, the first regional food compensation user database was finalized within a partnership between WAHO, FAO, Biodiversity International, and InFoods. We have some handouts over there. Partnership was broadened progressively. FAO, Biodiversity, and WAHO were basic leaders. Now we have brought civil society, especially the Network of Food Producers of West Africa, USAID, African Development Bank as financial institution, international NGOs, the ECOWAS Parliament. I used to attend several sessions to increase awareness on nutrition in food security of the Commission of Agriculture of the Parliament of ECOWAS. However, we are facing to several constraints in the framework of all these initiatives we are implementing. The first constraint is the negative effects of globalization in the food systems, the low investment in agriculture sector, integrating nutrition at regional and at country level, the coordination among partners, and this coordination was a recommendation of the 2008 ECOWAS Nutrition Forum I talked about earlier. And the last concern is the governance, more visibility in the way we are doing partnerships. In terms of challenges, we have two major challenges. Is to continue to strengthen the multi-sectoral, multidisciplinary, and comprehensive approach we are using up to now to integrate nutrition, food security, and health, agriculture, food security, and nutrition. The second challenge is to mobilize resources for the implementation of this 5-year action plan we have developed in collaboration with the community-based organization affiliated to ROPA and research institutions. In conclusion, the need for a collaborative partnership between agriculture, health, and nutrition is increasingly being recognized in West Africa. During the first 4 years, a strong regional, multidisciplinary, and cross-sectoral partnership is being strengthening. The overreaching objective of this initiative is to ensure the effective promotion of the local food resources from West Africa ecosystems in households, with strategies and interventions against food insecurity, micronutrient deficiencies, and diet-related chronic diseases. Thank you very much.